Hi guys, my name is Eric Beltran and today I am talking about pregnancy in adapter years algorithm for diagnosis of suspected pulmonary embolism. Summary. Pulmonary embolism is one of the leading cases of maternal death in the Western world due to the low specificity and sensitivity of the D-dimer test. All pregnant women with suspected pulmonary embolism sometimes undergo computed tomography, pulmonary angiography, or ventilation perfusion examination.
Few studies have evaluated the use of clinical decision rules, or D-dimer, to diagnose pulmonary embolism in pregnancy. The years criteria are used to evaluate suspected pulmonary embolism. They include 3 criteria to assess risk: clinical signs or symptoms of DVT, hemoptysis, and pulmonary embolism as the most likely diagnosis. On the basis of these criteria and their D-dimer result, patients may then undergo CT pulmonary angiography. In this multi-center international management study, 498 consecutive pregnant patients with suspected pulmonary embolism were assessed for D-dimer concentration and the years criteria. Patients who met none of the criteria and had a D-dimer concentration of less than 1,000 nanograms per milliliter, or with one or more criteria and a D-dimer concentration of less than 500 nanograms per milliliter, were considered not to have pulmonary embolism. Of the remaining patients, in those with clinical signs of DVT, the years criteria were adjusted for pregnancy to include compression ultrasound for DVT. In the absence of clinical signs of DVT or a negative ultrasound, CT pulmonary angiography was performed. The primary outcome was the incidence of venous thromboembolism in patients with initially normal tests during 3 months of follow-up. The key secondary outcome was the percentage of patients in whom CT pulmonary angiography was not indicated. With this approach, the primary outcome occurred in 1 patient who was diagnosed with popliteal DVT. No patient was diagnosed with pulmonary embolism. 39% of the patients were managed without CT angiography. Among the subgroup of women in the 3rd trimester, 32% were managed without CT angiography. The authors conclude that the use of the pregnancy-adapted years algorithm safely ruled out acute pulmonary embolism in pregnant patients referred for suspected pulmonary embolus. Full study results are available at nejm.org.
Application. Pregnant women with suspected pulmonary embolism sometimes undergo computed tomography, pulmonary angiography, or ventilation perfusion examination, in addition to evaluating chest pain and observing symptoms of shortness of breath.
Welcome to Queensland X-Ray, and congratulations on your pregnancy. At Queensland X-Ray, we offer our patients a full range of diagnostic pregnancy scanning, including the most commonly used like early pregnancy, nuchal translucency, morphology, and 3rd trimester scans. Regardless of the scan you're having, please arrive a little early for your appointment, as we ask you to complete a short health questionnaire. During all of our pregnancy scans, initially, only 1 person can be invited into the room with you. Our staff have an important job to do, and it also allows you some privacy if the doctor wants to talk to you. Once the scans are complete, if there is time, you may be able to invite a few others into the room as well. However, this isn't always possible. We also don't allow any photos or videos to be taken during the appointment. We appreciate it's an exciting time, but it's also a medical procedure, and our staff have an important job to do, making sure you and your baby are healthy. Scans take between 20 to 60 minutes, and each scan has different preparation requirements. We'll tell you what they are when you book your appointment. When you book, we'll also let you know if there is a cost involved and what you can claim from Medicare. An early pregnancy scan is performed before 12 weeks and confirms your dates, the number of babies present, and assesses the early development of your pregnancy. At this stage of pregnancy, a transvaginal ultrasound is often necessary, as the fetal structures are still very small. You can find out about this type of ultrasound by watching our transvaginal patient information video. A nuchal translucency scan must be performed between 12 weeks and 13 weeks 6 days. This scan assesses your baby's risk of being born with a chromosomal anomaly, such as Down syndrome, and the early structural development of your baby. Not every person chooses to have this scan. It is a decision only you can make. We recommend you talk to your doctor to help inform your decision. About 3 days before you have this ultrasound, you will need to also have a blood test. Our specialist software combines your blood test results and ultrasound images to assess your baby. From this, we provide your referring doctor a detailed report. At the end of your scan, our staff may discuss and explain some of the results with you. They can be a little complicated, but don't worry. Your referring doctor will go over these results with you too, in more detail. You'll need a full bladder for this scan, so please drink 500 ml of water 1 hour before your appointment. Between 18 and 20 weeks, your doctor will refer you to have a morphology scan. This detailed scan looks closely at the structural development of your baby, including the head, spine, heart, abdomen, and limbs. It's also during this scan we may be able to determine the baby's gender. It will depend on the baby's position, and of course, if you want to know. Your sonographer will ask whether you want to know the gender before the scan starts. A third trimester ultrasound is a non-routine scan performed after 27 weeks. You may be referred for this scan if you're having more than one baby, or your baby's growth needs checking, or as a follow-up to your 20-week scan. We can determine a lot about baby's well-being at this stage of pregnancy by looking at things such as the amniotic fluid and umbilical cord flow. Our friendly staff are happy to help you and answer any questions you might have at any part of your pregnancy journey. All you have to do is ask. Thanks for watching. We look forward to meeting you at one of our practices. For further information, please visit our website, queenslandxray.com.au.
Pros and cons. Pulmonary embolism was safely rolled out by the year's diagnostic algorithm adapted to pregnancy in all trimesters of pregnancy. Otherwise, they will undergo computed tomography, pulmonary angiography, or ventilation perfusion examination, but involving radiation exposure to the mother and the fetus.
Can I be X-rayed during pregnancy?
Generally speaking, X-rays damage cells. Ionizing rays may cause harm, in particular in the early stages of pregnancy. Our current devices no longer use the intensity of former times, so that women who are examined with X-rays without knowing they were pregnant do not need to fear. In 38 years of work and extensive dealing with malformations, I've had maybe a single case where I say that X-ray examinations were a possible reason for malformation. There, the uterus was exposed to the rays for a very long time, so that they have caused changes. I've not experienced any other cases apart from this. Generally, everything requires a strict indication, but where that is present, X-ray examination is possible.
Problem applied in Ecuador. At the San Francisco General Hospital in Quito, it was law associated with the look of law up of a clinical practice guideline that unifies the diagnostic management of pulmonary thromboembolism and in turn reduces hospital costs, avoiding requesting unnecessary tests. Conclusion. Pulmonary embolism was safely ruled out by the years diagnostic algorithm adapted to pregnancy in all trimesters of pregnancy. Pulmonary CT angiography was avoided in 32 to 65% of patients. Thank you.